As you begin your role as an exercise specialist, you'll see that there's a lot of new terminology. And we hope today to start covering some of that terminology to make your transition into this role easier. Let's talk about positional terminology. Positional terminology refers to medical terms that describe specific positions that patients will be in. This includes for patient setups and also for setting a patient up for the provider to come work with them, as well as exercises that they will perform. The first term that we'll teach you about is supine. This is a position where a patient is laying flat on their back. There's a variant to supine called supine hook lying. This is a position where a patient is laying flat on their back with their knees bent to a point where their feet are flat on the surface that they're laying on. While patients are positioned in supine position, especially if it's on a heat setup where they'll be there for a long period of time, we would ask that you consider placing one of the bolsters underneath their legs. This takes pressure off their back, especially for patients who have back pain or soreness. This will be a welcomed resource. The next position is prone. This is a position where a patient is laying flat on their stomach. Please consider patients and their inability to turn their head side to side. This can create issues, and we do have tables that have face holes where a patient can place their face within that hole. Please be sure to verify and communicate with other staff to ensure the comfort of our patient. The next term is side lying. This one is a little more self-explanatory. This is when a patient is lying on their side, either their left side or their right side. If we wanted a patient to be laying on the right side, it will say right side lying. When a patient's in right side lying, we again want to maximize their comfort by placing a pillow between their knees and their ankles. The next position is seated. This might sound very simple, and hopefully it is. But we would ask that you consider where you seat a patient within the facility. That you take the extra time to be mindful about where you place them. That if you're able to sit a patient in a way that exposes their body part to be worked on by a provider, you will be able to help us do our job better. We'll cover this further in other videos, but we're grateful for your attention to detail.